Hi guys! So this video we're going to talk about what nursing is really like versus what I expected it to be when I was a student. And oh my god, if you guys are student nurses and you're watching this video, wait till you become a nurse. It is totally different than what you would expect it to be. So granted, I work in psych. However, I did work in psych as a counselor, so I sort of knew the nurse role, and maybe you guys are CNAs or something like that, so you understand the nurse role. You've seen it in the hospital. However, when I say it's completely different, it's because we're in nursing school, right? And we're learning all of these things about nursing assessments and the assessment, the diagnosis. We plan, we do our interventions, and we evaluate. And a lot of people say, oh, you'll never use nursing care plans at work. And that's like semi-true. I mean, you're not sitting there every day with every patient going through your nursing care plan in the sense of like writing out an entire care plan. It's more the physical interaction with the patient. And I think that we all sort of understand that and knew that going through nursing school. However, in nursing school, when you are learning, you're like, okay, so this patient has this disease, and these are the interventions I'm going to do. I'm going to give them medicine or sit them up or give them O2 or, dressing changes or whatever. So you have this intervention that you're doing, and then you think, oh, and the patient's going to most likely either improve, hopefully improve, and then they're going to leave, and like, this is what nursing is. This applying nursing interventions to a medical problem to help the patient heal. And that's what we think nursing is, and that's true, right? These patients come in, whether it's psych or medical, and they have some sort of medical condition, and we as the nurse are giving them interventions to help improve, hopefully, their quality of living. We're giving them teaching and medications to help them get better, and then they leave. However, the thing I did not expect in nursing is all the, I don't know the word to use, honest. You are coordinating care with the interdisciplinary teams, which sounds lovely, and it is most of the time. I love working with interdisciplinary teams. You have social workers that are coordinating most of the outpatient things. You have OT and PT, and they're helpful in the care of the patient. Right? So interdisciplinary teamwork is so important in healing. However, what we find is everything falls on the nurse, right? So PT comes in, they walk the patient, they do what they do, they leave, they go on to the next patient. The medical doctors or NPs come in, they deal with prescription of medications, they're doing their assessments, then they leave. The social worker comes in, talks with the patient about outpatient appointments, then they leave. Everyone comes in for their set amount of time, and then they leave. However, the nurse is the one that is always with the patient, and the patient, when they're sick, cannot be responsible for coordinating all these people and all the care that needs to be done with all these different people, and that falls on the nurse, right? So, for example, the doctor may come in and be like, we need a CAT scan, or we need an x-ray, or we need, some procedure, right? So the nurse coordinates that. The nurse calls x-ray, books the appointment, brings the patient down, or coordinates somebody to bring the patient down. If x-ray finds something, they call the nurse. The nurse then talks to the doctor. You are, in a way, almost like the parent of the patient, right? And this is something that I did not understand in nursing school. Is like, I thought I could go in, give my medications, do my assessments, work with the patient, and go home. But what I found, and it's fine, it's all part of the job, and this is why I always joke that nursing school, like the fact that you are taking an exam that has multiple right answers is like totally messed up, right? But it's preparing you to be a nurse, because again, everything falls on the nurse, and most people who work in the hospital, they go to the nurse looking for answers, and sometimes you just don't know. So there's those types of things. Other things are the fact of like staffing issues. Like you're not, especially in COVID. You know, I think in nursing school you think like, okay, I'm gonna go in and I'm gonna have, even if it's in like medicine or something, I'm gonna have my 6 patients and they're gonna have their problem and I'm gonna give my interventions and I'm gonna evaluate those interventions and then I'm gonna, you know, change those interventions depending on what my evaluation was, and that's how my day is gonna go nice and smooth, right? I mean, granted, we can expect that if you're in the ICU or even in medical or even in psych, you may have those days where someone has a seizure, something goes wrong, there's a code blue. We can expect those types of things. But I think the thing that at least I didn't expect when I was a student is just everyone coming at you, right? All these people about your patient. So, you know, you're giving care that the doctor has prescribed, you know, whether that's the medication or a dressing change or whatever medical things are going on, you're giving the nursing care. But you're also dealing with, so now you're short. Instead of having your 6 or 8 patients, now you have 12 patients. So not only are you the charge nurse writing 12 notes, you as the nurse, it falls on you. You're the one that has to fill in when things go wrong, I guess, right? And that's kind of the thing I didn't expect about nursing. I thought I would go to work, I would do my job, and I would go home, but that's not the case. I love being a nurse. I really do. But I would assume that being a nurse is sort of like being a parent, and I don't have any kids, but I would assume it's similar, where it's just you love your job, you love being there, but it is hard work. And I hear people joke sometimes like, oh, you're a nurse, you work 3 12s a week, it must be so nice to work 3 days. And I'm like, you would not last 1 day as a nurse. Like it's tough. You're not sitting at a desk typing notes. I mean, maybe in some fields of nursing, yes, but when you're in acute care in the hospital, you're not. You're running. There are days I wear like compression stockings. There are days that I come home and my feet are still swollen because you're just on your feet for 12 hours and you're running around and you're dealing with problems, and you know, it is very, very stressful. I'd also like to add, especially with 2020 and now going into 2021 with COVID, our role as a nurse has changed in almost every setting. It's a lot more stressful. It's a lot more assessments and monitoring and rules, and you're wearing those masks all day, and it's just tough. Like, so for example, you know, I'm a psych nurse. I'm not a medical nurse. I do some medical things at my job. We hang IVs, we do dressing changes, we cath occasionally, you know, we do things like that. There are certain medical things we do, but I am not a medical nurse. I'm not suctioning patients. I mean, we'll do maybe oxygen or nebulizing treatment or something like that, but, you know, we're not doing anything super crazy medical-wise. And now we have COVID, and next thing you know, now you're a COVID nurse. Like, you weren't even a medical nurse, and now you're a COVID nurse. You're wearing full PPE. You're, you know, dealing with patients that have, you know, they may not have terrible symptoms now, but who knows, they could throw a clot. Next thing you know, you're doing CPR. You know, you don't know. And I think, you know, that's another part of nursing. It is like filling in because there is a shortage of nurses right now. So, I mean, all of those things, like, I think when you're a student, you're like, nursing is black and white, and it's not. There's a whole gray area, and you know, you are the one that everything falls on. Everything. You're the one that is the caretaker for this patient, and what that means is that you're with them, or the nurse is with them 24 hours, you know, if you're in an acute hospital setting, and you're coordinating care with all these disciplinary teams, and that means something could maybe be wrong or needed from one team, and it could also be needed from another team. So now your job of just doing your interventions, evaluation, assessments, and planning and all those things, now in that, you then have to add, oh, well, now we have to take aside time for court. Oh, now we have to coordinate this meeting. Oh, now we have to coordinate this x-ray or CAT scan. And oh, now we need to coordinate, you know, making sure that we ambulate the patients appropriately. So you're doing like all of these things that you don't realize that you're going to have to do when you're a nursing student. It's not just about the nursing care, it's about coordinating everybody else's care, which is a lot, especially when you're dealing with 8 patients. You could have 24 patients. I mean, I kid you not, these are the things that happen. And this is the problem with safe patient limits. They tried to pass that law, didn't happen. We do not have safe patient limits. And what that means is if a patient is admitted, a nurse is taking care of them. And that could mean that that nurse has 12 patients. Like, it's a lot. You're doing a lot. And I think in nursing school, that was the thing that I didn't realize, that I would have to be coordinating of everything. And unfortunately, everything falls on the nurse. Like, the nurse does it all. And it's a lot. It's a lot. So I always joke that nursing school is so hard because it's preparing you to be a nurse. And the biggest thing is being flexible and being resilient. And I truly believe that is why nursing school is so hard, is because they're trying to wean out the weak. They want people who are resilient, because there are going to be days at work when everything is falling apart, everything is going wrong. You don't have the support. You know, sometimes you don't always have the best team. That is what nursing is like versus what I thought it was like. So I hope this helps you guys in your nursing journey and like what to expect. I'm sure if you guys are sitting and watching videos about nursing, you are well prepared for when you go into the field, but hopefully this gave you a little more inspiration or a little more education on what you can expect when you become a nurse. So make sure to comment below. Let me know what type of nursing you're going into, because I'm just kind of curious. And make sure to give this video a thumbs up and subscribe to my channel. Okay, thanks guys. Bye.